Okay, so Julie, you just hurt your knee falling off your bike. So we can see that you have a bruise here. You can see that this is swollen. And you always look for swelling when there's a significant knee injury. And if I put my hand under this knee, I can't get it under the knee. I can get it under this knee. And that's a good test to show that the tibia has either moved forward or there's swelling, which is making the knee not straight. So now I want to do some tests, and I can do an anterior drawer test to see if there's any ligament laxity in the anterior glide portion. I can see that there's a little bit of medial laxity. You can kind of see how this bounces, and if I go laterally, it doesn't. So that shows that there's some medial laxity from this injury. And I can see some puffiness compared to this knee. And of course, as I said, it's already quite bent. Now we're going to figure out how to treat it. So we want to figure out how it's rotated. So if I rotate it this way, I'm taking the tibia and I'm rotating it externally and internally to see which way it will not move. And right now the knee moves externally. That feels nice and soft. It doesn't want to move internally. So it's what we call an externally rotated tibia, or it's locked and external rotation does not want to internally rotate. So we're going to straighten that out. And then we also want to take care of the fact that because I can't get my hand under there, this tibia I know has moved forward. So I want to move the tibia back. And that's why you'll find a lot more anterior cruciate strains and posterior cruciate strains of the ligaments, because that ligament is very often easily irritated. So I'm going to push more on this side. Because the tibia is rotated this way, I want to push it a little bit that way, okay? So what I'm going to say now is I'm going to push it from anterior to posterior, and I'm going to put a little rotation in there by pushing harder over here on the medial part of the tibial plateau. So Julie, I want you to gently push your knee toward the floor. That's good. And I can feel it release and soften. And then relax. Let's do it one more time. That's pretty locked up. So gently push your knee toward the floor. And again, I'm pushing a little harder with my left hand over here than I am my right hand. There we go. Now let's test it again, see how it rotates. So I'm rotating it externally. And now we're getting some internal rotation. So it moves externally and it also moves a little bit internally. I'm not happy though yet. Let's do it again. Gently push your knee toward the floor. I want to get a little more rotation out of it so it's in the middle of the joint. So it moves normally in external and internal rotation. And then relax. And now it goes internally, and now it goes. Now I'm happy because it's floating in the middle. But we also want to see if this tibia has gone medial or lateral. And that's another problem that can happen, is a side or lateral bending strain. But see, now I can't get my hand under there, so that's a good sign already. So I get the knee in a neutral position. And what I'm going to do is I'm going to push on the lateral part of the tibia and the medial part of the tibia. And I can feel that if I push on the lateral part of the tibia, it's soft, and the medial part is hard. That means the tibia has shifted that way. So, okay, Julie, I want you to gently push against my hand there. So I tap, and then she knows where to push, and just hold. And I'm holding until I feel it soften, and then relax. And let's retest that. So I'm pushing it lateral to medial, medial to lateral. Push again, please. I'm pushing from medial to lateral. Great. And then relax. And that's better. Now it feels like it's floating because I can push the tibia from lateral to medial and medial to lateral. So that's great. A little bit more. Push one more time, please. I want to really make sure that the tibia is relating well to the femur. And then relax. Good. I'd probably put some laser in here, and I'll show you that in the laser section. But right now I'm just going to show you how you might then stabilize this. That's better. Okay, so what I'm doing is I'm going to put some tape on there. And I'm using some coverall stretch tape. And turn your knee in just a little bit for me, Julia. And I'm going to put a piece on the side. because this is nice tape because it acts like a ligament. I've used a lot of the kinesio type tapes, kinetic tapes. I don't find them quite as stabilizing, so I often use this tape. And this will give us almost like a lateral collateral ligament. Then we're going to put one on this side. This is going to be like a medial collateral ligament. That's great, thank you. We're going to actually try to create an anterior-posterior cruciate ligament. So what I'm going to do is I'm going to put this little pad under her leg so I can get behind it. And then I'm going to create a ligament to prevent rotation and anterior glide. So a great way is to do a little bit of a 30-degree angle here. So I attach this to the tibia, and then I attach it behind to the femur, and it acts like an anterior and posterior cruciate ligament and also prevents rotation or rotational instability. And then I put the same thing on this side. Okay, now we're going to recheck everything, so let's see what it looks like. So I'm going to, again, test it from anterior to posterior, and that feels much better. It's nice and springy. It was quite tight. Let me try to rotate it. And when I rotate it gently, looking at the component motions, it feels very even. It's right in the middle. Let's see about the lateral strain where the tibia was going in that direction. See, now when I push on the tibia, it moves beautifully in both directions. And that means the tibia is relating very well to the femur. And then we have the tape here, which stabilizes any kind of lateral strain. And we have the diagonal tape, which will stabilize rotation or anterior translation of the tibia. And voila, there we have a knee that's been fixed. Perfecto, we're all done.